All, this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. I think out of all the shows that we have done, this is possibly one more of the important one. I think there are 3 or 4 critical ones, and this is one more of such type. In this show today, we will not just talk about the vaccine associated clotting, but more importantly, we'll talk about the management of it. What I'm seeing is, and I have been calling various friends of mine who are practicing, some in the ICUs, some outside. And I've been asking that, hey, how would you approach if you saw Sputnik or AstraZeneca or Johnson & Johnson related clotting? And then there is, some are very sharp and they say, here is what I'll do. And they are spot on, and some are confused. And then those folks who are outside the hospitals, they are even less aware. So I wanted to do this video. I am nervous about doing this because the drugs that I would discuss here can cause bleeding and even death. So this is something that you should not take over the counter, number one. Number two, I am happy that I would do it for educational purposes for medical professionals so that they are ready. I am seeing this readiness is not generally available outside. And for all of the rest of us, it is just informational video to understand how this management will be done. So let's start. Just like the morning video, I would request if you can just bookmark this video or put the link somewhere. This is an important video from a management point of view. So this is Drbeen.com. This is the joint statement by CDC and FDA. This is the context of the discussion today. Then here are the various links that will be used today. One of the link is to my own video as well, where we discussed aspirin's mechanism of action. Then there are various other links that show either the drugs that we are going to talk about or the tests that we would do to figure out what a patient's situation is and the molecular mechanisms of those tests. So with this, there is also a calculator here that is also in the link. This calculator is important, usually used in the hospital or by a doctor to understand if their patient may be developing heparin-induced thrombocytopenia or thrombotic thrombocytopenia. So if you are a doctor or a nurse or an NP or a PA and you are concerned and you wanted to understand the possibility of HIT, then you can use this calculator as well. So with this, let's start our discussion. So these are our gifts for humanity. They're continuing. So this is the possible approach that your doctor would take. If a doctor would take, not your doctor, I wish you no harm at all. I wish you do not ever get this situation. So a doctor would take this when they have a patient like this. So please see this warning here. The drugs that I'm going to discuss here, their inappropriate, incorrect use or your body's condition, for example, let's say liver's condition or kidney's condition or your blood's condition can actually cause death. So hematologists have to be seen. And now the spilling the beans right in the beginning, the main management has to be done in the hospital. So if somebody is experiencing these things, these symptoms, which we'll talk about, they should go to the hospital or call 911. That is one. Now, some folks have been asking that, hey, tell us right in the beginning so at least we know what it is. So here is the general approach to the management of this. Management is done in hospital or in ICU, and Drbeen is given. It is a thrombin. It is an antithrombin intravenous infusion. It is calibrated to the patient's situation. It is not something that you just take and use it. And secondly, because it is metabolized by the liver functions have to be known before this is given. So that is the approach. Drbeen is given, then patient is moved to ICU. Outpatient, first thing to do is to plan to take the patient to hospital. And during that time, if the patient, for example, the hospital is far or there is going to be some time on the way, then rivaroxaban, apixaban, or even aspirin may be used just for that time. But please do not try to just manage these patients outside in outpatient and think that they would be okay. This situation can cause severe bleeding and the patient can actually die, or they can develop permanent brain damage or cardiac issues or other issues. So please don't take a risk on these patients. Now, details of this. So there is a possible association of adenovirus based vaccines with the clotting reactions that we are seeing. These vaccines, for example, Janssen, which is Johnson and Johnson, that was stopped or paused today by CDC and FDA. AstraZeneca, about which I talked a lot, and that caused a lot of people to become very upset with me. Sputnik, which is Russian vaccine. So nobody has yet talked about Sputnik, at least in this area where we are in America and Europe. And this talk is going to come up at some point because Sputnik is also composed of adenoviruses. Now, what is seen in the US for the CDC and FDA? They saw that young women 18 to 48 years of age, they developed, so out of 6.8 million doses, 6 cases were seen with the clotting disorder. Unfortunately, one woman died. One is in hospital being treated. We'll see. We pray for her that she recovers. The women on hormone replacement therapy that are in above 50, I do not know the data about them. So far, everyone is saying that, hey, below 50 is the risk area. So I would consider them to be safe. Australia actually approved this AstraZeneca, for example, to be above 50. Now, in the US, when we talk about 6.8 million doses administered, the question is, how many of those were women? Was it 50-50? And if that is the case, then they were actually 3 million doses to women, out of which 6 cases were. And then out of the women, how many were young women in this age group? So were they 1.5 million or 2 million? I do not know that data. But that data would actually tell you even more better what is the situation. And then I totally understand, and I am aware that everybody continues to say this is a rare situation, this is a very rare thing, why should we be anxious, and so on. People have been putting comments that your chance of dying in a roadside accident is more than getting this and dying. Well, there are people who have died, and there are people who might die because if we are not prepared. And this preparation is actually simple. We can save them. So if you can save someone and then you say, hey, you know what, forget about it, it is a negligible thing, then that is quite dishonest and quite an issue with humanity of somebody. Let's continue. Now, what are the clinical signs and symptoms? Again, this is important that this would happen within the first 3 weeks, as CDC and FDA put it. Some of the doctors and the news for AstraZeneca has said 5 to 16 days. Some reports have said 3 to 16 or 17 days. I will put it this way for the cool beans. We have talked about adaptive arm forever. Adaptive arm takes a few days to become active, and in everyone it is different time. And then it continues to build up for a few days or weeks. So that is the time in which this attack can occur. So we have to develop antibodies when the attack occurs. This also means, and this is very important that I'm going to talk now, is it is possible that when a person gets Johnson & Johnson, they would get flu-like symptoms that includes headache, which continues for a couple of days. My wife, when she got Johnson & Johnson, she did have headache for a couple of days, and she said it is more than my usual headaches. But that was as soon as she got the dose and for a couple of days. Then that headache subsided. This headache here, in the beginning, the very first couple of days, is usually not the headache of the clotting. But after 5-6 days, and within the first 3 days, if the headache is severe, that the patient says, I have never had this severe a headache, and the patient says I need to be in hospital because of the headache, that may be an indicator that there is a bleeding going on. So please realize that persistent headache that starts after 2-3 days, nose bleed, gum bleeding. For example, a person is eating something, and normally when she chews, there is nothing, she's fine. And then today, let's say 4 days after the vaccine, she's eating something, and then all of a sudden she feels a distaste. And when she looks at the food, she has blood there, or her mouth is bleeding, or her nose is bleeding. These are the signs of thrombocytopenia. Shortness of breath, again persistent. GIT pain, persistent. Leg pain, persistent. Within 5 to 7 days or within the first 3 days. So these are the signs and symptoms. I remissed writing here petechial hemorrhages, or the small pinpoint hemorrhages under the skin, and bruises. So let me actually show you how a petechial hemorrhage looks like. So if I say, so again, I do not know whose pictures are these, are copyrighted or not, so I'm going to just close this. But these are petechial hemorrhages. Please Google it and see it. So bruising and petechial hemorrhages are possible as well. So these are the clinical signs and symptoms. Labs. What can a doctor do to figure out this is happening? So very generally, what happens is, what we are talking right now is very similar to heparin-induced thrombocytopenia as well. The management and the labs and everything is the same. You could say we are studying heparin-induced thrombocytopenia. So the labs here are, number one, ELISA for PF4. And we have talked about platelet factor 4 and its action in this situation. If you would like to know more, there is a video titled AstraZeneca Causes Blood Clots, a German research. So you can watch that, or you can watch some part in the morning as well that I talked about how this happens. But here I want to focus continuously on the management approach. So platelet factor 4 antibodies are detected by ELISA test, and that is a quick test. One can find that out easily. And here, strong levels. Lower, weaker levels are usually not indicative of the vaccine-induced issues, but a stronger level is indicative. Reference the German research paper. Complete blood count to understand the thrombocyte count. Normally, thrombocytes are, or the platelets are 150,000 to 450,000 normal. But if within 3-4 days, the count has dropped below 50%, that is a sure sign that there is something going on. And the person should be immediately in the hospital to take care of it. They can be protected, they can be saved. It is not a rounding error to say, well, this is so small a number that it's okay. No, they can be saved if we can find them out earlier. Usually what happens is, unfortunate thing is that usually the bleeding or the bruising, these occur when the platelet count has really dropped a lot. And the window to protect and save becomes very small. So as soon as somebody gets these symptoms, they should talk with the doctor and try to make sure that they are in the hospital. Bleeding time is done during the management as well. And please let me say this for the medicos here. As soon as you suspect that this is a situation like HIT, that is heparin-induced thrombocytopenia, here we are not talking about heparin, but the signs and symptoms will be the same. So as soon as you suspect that, you have to start management. You are not going to wait for the labs to come back. You're going to start management while you're getting the labs. And this is why the patient has to be in the hospital, so that when you've started the management, you can take care of them if extra blood thinning has occurred or any other side effects have seen. So bleeding times will be needed. Platelet activation or aggregation assays are available as well. So what happens is you can send the patient's platelet to the lab where they can put various chemicals on them and try to activate them. And if they very quickly, rapidly respond, then they are activated, and that can tell you if the platelet are in activated state. They would very quickly start aggregating or activating. Then Doppler for legs must be done. So even when you feel that, hey, the patient has headache, and we are just going to look at the headache, and we're going to start doing blood thinning, you must still go to understand the legs situation. So Doppler for legs must be done to rule out any microscopic thrombi that may be present in the legs and might start clotting in the legs afterwards. And then APTT for treatment when you are giving specially argatroban. And this is also important for treatment calibration, that how much of the dose should be infusion should be adjusted and given. So these are the general labs. Now, once again, what is the management approach? Once again, if you are a doctor or a nurse practitioner, physician assistant, nurse, you see a patient in this state, the first thing that you have to do, other than making sure that they are stable, is to get them into the hospital. So that is 911 or whatever. If you're already in the hospital, admit them. So here, this is the treatment approach so far. We are on 13th April, and I believe that this approach is not refined for this situation, because this situation, this event has not been accepted as caused by the vaccines. Because it is not accepted, there is not a formalized algorithm to say, do this. I am actually very upset with the companies, like organizations like CDCs and FDAs and WHOs. On one end, they are hitting the people by bad mouthing things like ivermectin. On the other end, where they should do their work, for which they're doing everything, they're not able to quickly get ahead of these things. Anyways, here, let's see what needs to be done. In case of prophylaxis, and once again, prophylaxis is that somebody is going to be receiving, for example, heparin, in this case, vaccine. And if you are suspecting that they may get a negative result, then prophylaxis may be needed. If I am the doctor, I would tell the patient, if they have a history of clotting, if they have a history of HIT in the past, I would just ask them not to take Johnson & Johnson. They can take something else. Or AstraZeneca or Sputnik, don't take on any of those, take something else. But if somebody has to be put on prophylaxis, aspirin, rivaroxaban, apixaban, these are all oral anticoagulants. They can cause severe bleeding and hemorrhage and strokes. So this is not something that you just go and start taking it. Aspirin is much more common in use. It is a cyclooxygenase blocker. We have done this discussion in the past, and I have this video here as well if somebody wants to watch it. The rivaroxaban and apixaban are factor 10 complexed or non-complexed, and that for medicals, the non-complex is the free factor 10, and the complex is the factor 10 that has started making the complex in the clotting area or in the clotting mechanism. These, both the drugs, can actually inhibit or suppress factor 10, and by that they can suppress clotting. The important thing is that you have to see the liver function. You have to make sure that the kidneys are working okay. Then pregnancy and breastfeeding are other things to notice as well. And if you are someone who does use these drugs, then you should know them. If not, then please make sure you read those up before you try to use these. These are dangerous. Then if the patient is an outpatient, so let's say you have a patient who came to you and said, hey, I had my vaccine a few days ago, and now here I have this severe headache. So once again, rivaroxaban or apixaban can be the solution, but the first approach should be call 911, move to the hospital. And now hospital move would take some time. You are afraid that on the way there still needs to be help, then start helping with these drugs. Then hospital. In the hospital, we give the thrombin inhibitor. So that is the argatroban. That infusion will be started, and then the patient will be moved to ICU. Argatroban is metabolized by liver, so liver functions have to be seen, the history has to be taken, and you have to be careful. If you do not know the history, or if you do not have the liver function test available right away, then start it at a lower dose and then titrate as you get your results back. And then once the argatroban is done, once the patient has become stable, and what is the definition of the stable? At least 100,000 platelets per microliter. Once you have, the patient has recovered to that level, then they can be transitioned to oral warfarin for 30 days, and then they would continue on that. Do not use heparin. Why? It is not actually necessary that a person who has developed vaccine-induced thrombosis or thrombocytopenia will have a same problem with heparin as well. But it is possible that if their platelet factor 4 became a target with vaccine, it might become a target with heparin as well. And giving heparin, administering heparin would actually compound the issue and accelerate the problem, potentially killing the patient. So heparin, in heparin-induced thrombocytopenia and in this vaccine-associated, look, I'm trying to use a word so people don't become upset that I'm saying cause and this does not talk about cause. Associated, let's use that word. So if it is vaccine associated, still do not use heparin for anticoagulation. This is what is indicated by CDC over here. So if you read this, they said there is a word unique here. So 1 second. So here, this is important in part. So what they're doing in part to ensure that the healthcare provider community is aware of the potential for these adverse events and can plan for proper recognition and management due to the unique treatment requirement for this blood clotting. And the unique requirement is you cannot use heparin. Number one. Number two, you may have to look at their immune status as well to see how much their immune system may be overreacting. So now if I go into the mechanism point of view and thinking about what else may be needed, if this is a vaccine causing this issue, you can't just take the vaccine out. Just like in case of heparin, you can discontinue the heparin and the patient would start recovering. Here, the vaccine is given, the immune system is going to now continue to churn for some days. So during that time, you may actually have to do some immunosuppression as well to block the antibodies. That means IVIGs may be needed, which is not part of heparin-induced thrombocytopenic thrombosis or thrombocytopenia, because usually it becomes controlled with the other medication. But here there may be a need of IVIG, or there may be a need of immunoglobulin 3, or there may be a need for suppressing the production of IgGs or suppressing the B cells themselves that are producing antibodies. So it is not only to suppress the platelets from becoming thrombotic, becoming aggregated, but to actually also look at the immune system and kind of modulate that and control that as well. That may mean steroid may be needed as well. So the management eventually, I believe, for this situation is going to become slightly different from HIT. So this is the discussion today. My request to everyone who is listening, please, if you can just keep this link, the morning's video and this video, keep this link. Yes, it is a rare situation, but think about it. How many millions of people are going to receive AstraZeneca, Johnson & Johnson, Sputnik? Doctors would need to know what to do. And a ready, handy, available video, the very first page shows what is needed to be done, I think would be useful. So please, if you can like, subscribe, and share, that is great. If not, just keep this link handy for someone who needs it, and you can immediately give it to them. And your own message, if somebody suspects this 3-4 days later, the first thing to say is go to hospital. Go to hospital right now. Go ask your doctor to start giving you anticoagulants, but these should not be heparin. This is it. This is the summary of the message. So I'm going to stop here. Please like, subscribe, and share. There are 3 links in the description. One is if you would like to buy me a coffee. The other one is if you would like to become a patron. And the third one is to support this work in general. And I would see you in a few minutes. Thank you very much.